going to demonstrate doing a hand massage. Most of this hand massage will be on self-massage, but just to show you how you might be doing that with someone else, I've got Steve, who's come along here to lend his hand.
Hiya.
To show you, if you're working with someone else, what you want to do is focus on keeping that wrist nice and relaxed but straight. So when you're working on yourself, you can easily relax your hand like that. But if you're working with someone else, what you would want to do is take their hand and grip round the thumb. Yeah, so you're putting your thumb against the other person's thumb, and that means that you can then use your fingers to go around the wrist area. So what that means is that on this position, you've got a nice firm grip. They can relax their hand really well because you're actually keeping the wrist straight. You're holding that nice and comfortably. And then, of course, what you can do is turn the hand over, just change your grip. But again, notice how your fingers are keeping your wrist nice and straight and relaxed. Okay, thank you, Steve.
You're welcome.
Okay. So if you're going to start doing a hand massage, there are various oils that you might want to try. You can use a massage oil, which is what I'm going to use. And the reason for that is it's lighter and it's formulated to be able to stay on the surface of the skin for some time, enough time to do a massage, but it won't get too greasy. Now, if you don't have a massage oil, what you might want to use is olive oil. You need very little of it, but olive oil can work very well for a massage, and it's actually quite good for your skin as well. So there's no problem using something like that. You can, of course, use something like a serum. What you need to remember is that in just a few minutes, if you want to do a nice quick massage with someone, you might have to keep adding some because it's going to soak into the skin. Lotion. What you need to think about with a hand lotion is, again, it's going to stay on the surface a little bit longer than a serum, but it is actually going to work its way into your skin, so it's going to maybe need a bit of a top up. And the final one that you might want to use yourself is a hand cream. This is the one that will stay on the surface longest because that's what it's formulated for. It's a protective layer on the surface. So you might want to use a cream. Again, it's not going to be quite as good as a massage oil in length of time. So you can use a cream, and it's a very nice thing to do for a slightly quicker massage. So I'm actually going to use a massage oil, and this massage oil comes with a nice pump. And remember, you're not going to use a lot of oil. So I'm going to take a little bit of oil, and the first stroke I'm going to do, that's too much oil. The first stroke I'm going to do is effleurage. Now, effleurage is a stroke where you're working across the body or up and down. If you're working on the limbs, what you want to do is a slightly stronger stroke as you go towards the heart and slightly lighter coming back. Remember, when you're doing effleurage, that if you're working nice and slowly, you're going to start doing the relaxation. If you're working quickly, you're doing a more vigorous massage, which is more suited to sports massage, for example. Okay, so effleurage on both sides. Remember, as you're working on yourself, try as much as you can to keep your wrist and arm and hand as relaxed as possible and keep that wrist straight. Yeah, that's why I've actually got a pillow here with a towel on it so that it's at the right height for me to be able to work and keeping that nice and relaxed. So I can turn my hand over and do effleurage across the palm of my hand. Working, I can go around the wrist. So I'm spreading the oil. What I'm also doing is just checking, what can I feel going on there? Are there any sort of lumps and bumps? Are there any tender areas? How about the sensitivity of the tips of the fingers? Maybe they're a little bit cold on the tips of your fingers. So just taking into account a lot of these little bits and pieces, effleurage gives you time to do that. Another thing to think about when you're doing effleurage to start up, it's like doing sport. You want to make sure that the muscles are nice and warm. So if I have got some cold fingers, I tend to get cold at the end of my fingers. Just spend a little bit of time using your body heat to warm up those areas, warm up the muscles. you don't want to be working on cold muscles because they're not going to relax and have the blood flow that you want. Effleurage will stimulate the blood flow, it will get the body moving. You'll notice that what I've done is effleurage on this side of the hand and that side of the hand. Now this, if you remember from the anatomical position, your hand in that side with the palm facing up is what we would call the supine side. So if you're lying on a couch, the whole body, you would be lying face up, you would be supine. If you're lying on the other side, so this side is prone, lying prone. So I can supinate my hand or I can pronate my hand. Yeah. Now these are useful to remember, particularly lying supine with your hand. Remember from anatomy that when you think about going from the wrist up to the elbow, this is the position where those two bones will be lying separate. Yeah. If you pronate your hand, you're going to have that twist in the bones. Yeah. Now you can feel that on the bones, the radius and the ulna, going from the wrist up to the elbow. Okay, so after doing some effleurage on both sides of the hand, then I want to start thinking about doing some massage on other parts of the hand. Okay, so I'm starting in supine and I'm going to start working on the base of the thumb here. Now this is a really nice spot with lots of fleshy, soft area there. And what you can do is use your thumb to do circles around that area. It's a nice way to start, but you don't have to start with this. You can do this sequence in various ways. But this is quite nice because it does help to relax. Remember to try and keep your hand and arm relaxed, but keep your wrist straight. Okay. So you can work there, and I'm using my thumb to just do circles. I can also work across the palm, and I can do circles there. And I can work along this side where the knuckles are. I can do circles all the way around. Yeah. I can also then start to work down each finger. I can just rub using circles all the way down each finger. I can do each one in turn. It really doesn't matter which finger you start with. What you're doing is you're stimulating the blood flow, you're working with your thumb, you're just kneading it, kneading each part, just feeling again to see if there's anything going on there. Yeah. Turn your hand over, so pronate your hand. And again, you can do a similar kind of thing. You can work using little circles going along different parts of your hand. If you remember from the anatomy, from your wrist, the bones that go from your wrist up to your knuckle line, these are the metacarpals, and you should be able to see where from your finger that bone continues. So each finger there's a bone continues, and the bit that you want to work on is between the bones. Now the reason for that is that what you're actually working on is freeing up any adhesions from any of the soft tissue, the fascia, for example, that is between the bones and the muscles in there, and you want to free them up. Now this time, because of the size, my thumb is going to be a little bit big to get into that space, so I'm actually using one of my fingers. Okay, so again what I'm doing is using little circles, and I'm working as a general principle from the furthest away part towards the heart, and it's a good principle to just keep in mind. You can change it for some reasons, but it's actually a good thing to do. Okay, so I'm just working up those bones, just going along between the bones, just working my way up. Now, you remember from anatomy, your fingers, the phalanges, there are three joints. There's the knuckle and then a joint and a joint. Your thumb only has two joints. Okay, now what you can do is again your little circles, whichever is comfortable for you. Do a circle around each of the joints. Yeah, you're stimulating each of the joints. across the knuckles. You can stimulate each of the joints, just working. Just see if any parts are tender, if you need to do a bit more work on any of these. Now, what I'm doing is I'm supporting my hand closest to the heart so that the bit that's further away is the bit that I'm working on. So if I'm working here, I've got to support this side, yeah? If I'm working here on this knuckle, this joint rather, what I've got to do is support on this side, yeah? Okay. And then what you also want to do with each of the joints is just move them backwards and forwards. Now this is what we call a passive movement. So the person who's getting the massage isn't doing anything. Their muscles are not firing. I'm doing the movement, okay? And again, what you want to do is hold the bone closer to the heart, and then on the joint that you're moving, so you're not trying to do the whole thing like this, because then you're moving a lot of things at the same time. Okay, so what you want to do is hold that and then move that joint, yeah? So it's just that joint. So you can work your way, each of these joints, you can do a movement there and a movement there. And this is where, if you're working with someone who perhaps have arthritis in some of their fingers, what you'll find is that some of these joints don't really move that much. Now, massage is not going to change the condition of arthritis itself, but what you can do is help to ease some of that by doing this passive movement. So the person doesn't have to actually do any of the work, you're doing the work. Now if you can move if you've got arthritis in this joint, for example, if you can move that just very gently, that can be very soothing and helpful. Okay. Another thing you might want to think about if someone has arthritis in any of their fingers, what you might want to think about is using something like an arnica salve. A tiny little bit of that can work really well doing a massage. So if you've got a problem with that joint, just get a little bit of salve and then work that on that joint. So you can do the little circles around the joint and then move the joint very gently. Similarly, somebody who might have thinning hands, it would tend to be on the back of the hands that it's thinner. So just be careful. You'll notice that I've removed all my rings and watches and everything, so I'm not going to cause any nicks or scratches or anything on the skin, but just be gentle on the surface if somebody has actually got thinning skin. Okay. You've also got in the wrist, if you remember, you've got all these little bones which are all in the wrist area. Now what you can do is, again, your little circles all the way around each of these bones. What you're doing is stimulating the blood supply, and you're also helping the body to get rid of any adhesions amongst these bones. Again, you can do both sides. You can work around these bones in the wrist area. When you come to the final part of the massage, this is where you might want to continue by working up the arm. So nice smooth strokes, and remember you can use your breathing all the way through the massage. So if you're breathing, if you're giving the massage and you're thinking about your breathing, that will help the other person and also help you to just relax a bit as well. So as you're working, you can think about most of us, when we start doing massage therapy, we go too fast. So if you want to relax, remember, slow down and use your breathing to help you slow down. Remember, if you are going to do any work in between the bones that are on your arm, remember that the bones will be crossed over if you're lying prone. If you want to supinate, then you'll have the space between the bones that you can work on there. When you get to the elbow, remember that you can work on this side of the elbow really well. This side of the elbow, just avoid doing massage on that because there's not a lot of space between the nerves and the blood and so on that side. So similarly, the back of your knee, you would probably do a stroke up and then lighter, avoid that area, don't do any work actually in that area itself. You can go up to about here and then avoid the inner elbow. Okay, so finish off with effleurage, and then an interesting little thing you can do is basically just go along each of the fingers and rubbing down the finger, flick off the end of the finger, a little flick, and it just kind of finishes off the massage. Okay, so I hope you found that useful. You can do each hand in turn, and what you might want to do is think about how a massage can work into a slightly longer pamper treatment that you want to give yourself maybe once a week. Hand massage is a great way for you to start thinking about self-care and think about how your body is actually working and responding to